I'm Michelle Kittleson, heart failure transplant cardiologist at Cedars-Sinai in Los Angeles, California. We're joined by Dr. Yuk Law. Dr. Law is director of the Cardiac Transplant and Heart Failure Service at Seattle Children's Hospital and professor in the Department of Pediatrics at the University of Washington School of Medicine. So let's end with follow-up. You have successfully ushered your patient through the tumultuous course of myocarditis. They have survived. They're going home. What does surveillance look like? Tell us about activity restrictions. What happens next?
Yeah, I think that part is simpler in terms of being cautious. Even if the function completely recovers, which is a very common scenario in pediatric myocarditis, even if the function completely recovers, we would hold off in recommending anything exertional and certainly competitive, meaning going back to high school football, for example. We would not recommend that for probably 6 months. Even if the kid feels, I'm fine, I can climb 10 flights of stairs, nothing is bothering me. The reason being arrhythmia, not because we're worried about some exertional strain on the heart, overworking the heart, like the old days with rheumatic fever. I don't think that applies here. It's really, is there scarring? Is there a nidus for lowering the threshold of arrhythmia when there's a catecholamine drive? So I think that would be the safe approach. I think the tougher thing is now what do you do for the next 5, 10, 15 years? And also when you hand over your patient to the adult cardiologist, or do you need to hand over it? Do you need to follow up with cardiologists? My personal feeling is that follow-up should be done by cardiology. It doesn't have to be every 6 months, every year. In someone who's completely fine, perhaps after the first year, they can space it out. Our concern is that we do see cardiomyopathy with no family history, no genetic diagnosis, no insults, cardiovascular, you're talking about pediatrics, no unlikely diabetes and coronary disease and stuff like that. Yet we see cardiomyopathy. And one has to ask, is it because they took a hit by myocarditis, by a viral pathogen, myocarditis, years ago? And so as a result, we believe there should be follow-up, okay? And it's up to the discretion, the family and the practitioner, just to make absolutely sure that the heart does not remodel later, not from ongoing myocarditis, but there's an injury that somehow signals the heart to lay down scar and remodel itself in a bad way.